I have a diagram for you.
A diagram.
So, there are three or two blood vessels. This splits into two. So, three blood vessels. The main one, the Widowmaker one, has a 95% critical blockage.
Yeah.
Let it
Huh?
take its effect.
Another 60 to 70%, 40 to 50%.
Okay.
This is
Yes.
small, not a big deal. The heart function is normal. The heart is strong, no damage. The valve, like what in the echo showed, the valve is sticky and thickened and is moderately narrowed. So the valve that's causing the murmur, that's the aortic valve,
Right.
has a problem. The carotid artery, block in the neck, has at least 70% blockage. 70% severe blockage on the right side.
Okay.
So
All right, cool.
I called our heart surgeon,
You're welcome. Thank
Dr.
you.
Chagli. I was with him and he looked at everything. He agrees that a good option for you is open heart surgery, where they can fix the valve, take the valve out, put a new valve in, and also bypass double or triple bypass for the main artery and its branches. And then we're gonna decide about fixing this at the same time or not.
So the
What did
carotid
it-
artery is like two separate procedures?
That's a good question. That to be determined.
I'll be over here.
We're gonna order a carotid ultrasound just to get more information by the ultrasound. And
What will they do about that?
yeah, there are two options or three options for carotid blockage, generally speaking. The first one is medications. Okay? Second one is to clean it out surgically by making an incision and take that blockage out, clean it out. Okay? The third option is put a stent. To put a stent, you have to have symptoms. You have to have a stroke or mini stroke. So if you didn't have a stroke or mini stroke, which you didn't, right? We cannot put a stent. So either we treat medically or do surgery. Those are the only two options approved right now.
What's the first recommend? Try the medication if that doesn't work. then
Yes, we just need more information with the carotid ultrasound before we kind of jump on it. Kind of borderline blockage. It's not tight, like 99%, and it's not 40%, so it's kind of right, moderately severe, right at the borderline. So the carotid ultrasound will add more information to us. Now you did have radiation to your neck,
Yes.
and what cancer?
Lymph cancer. Left cancer in two lymph nodes.
Lymph nodes, lymphoma,
No,
It wasn't lymphoma.
it was, what's the
carcinoma,
Squamous cell
carcinoma?
carcinoma.
Yeah, so,
carcinoma.
Squamous cell carcinoma.
yeah, squamous
What
cell
did they say
carcinoma.
where it's coming from?
They don't know. They
They
didn't
don't
know.
know.
And what's the status of the cancer?
Clear.
Clear all?
Yeah, they took out 22 lymph nodes.
Yes.
There was cancer in 2 of them.
Yes,
They
And
did
so
CAT
that,
scans a couple of weeks ago and so it's clear.
it's all clear. But you did have radiation all to your neck.
Oh, yeah.
So
6 weeks of that, 5
Perfect.
days a week, and then he had 2 chemos.
now radiation induced blockage. The radiation could cause scar tissue
Yeah.
in the carotid artery.
Yeah.
Not only plaque buildup, but also scar tissue, and that makes it hard for surgery.
Right.
So that's why there are a lot of stuff to be determined.
Right.
Generally, we do not do surgery because once you go there, a lot of scar tissue, the vessel is is stuck to the tissue and it's hard to go and go down there. Generally, we stent those, but we cannot stent if you don't have symptoms.
Right.
So we'll make some decisions about the carotid once we get the carotid ultrasound. If the carotid ultrasound confirms that the velocity and it's really tight, then we cannot leave it alone because if he does open heart surgery with a bad carotid, you end up with a stroke.
Right.
Okay? But also, if he fixes the carotid at the same time, that adds to the risk of the procedure, makes the procedure a little bit long because you're doing 3 things. You fix it, changing the valve out, you're doing bypass, and you are also clearing out the carotid. 3 things more, where you arrest the heart, and because you bypass the blood to a big heart blood bypass machine while you're working on all these organs. So decisions to be made. The heart surgeon will talk to you sometime today. Dr. Chagli,
Chocolate.
is really outstanding. Honestly, he's one of the best. I think he was.
See, I thought you said yesterday, and I told everybody
Yes.
that if it was,
Yes,
that you would do the bypass,
yes.
but you're not doing it because what, it's worse than you anticipated? In layman's terms?
So that's an option. Another option is to put stents. So if we put a stent, that would be put a stent in the major artery of the heart.
Right, so you got in there, saw all that.
And
said
we could put a stent.
Not a candidate for stents. Right?
Okay, what do you mean?
I thought she said that.
We could put a stent. Stenting is an option, but that would not fix the two other problems.
The valve.
Okay.
And or the carotid.
Right.
And we
But
cannot
I
put
thought you would have gone right into bypass today.
No, I did not say that. You must have
Okay.
misunderstood me.
What?
Bypass needs preparation.
Right.
Okay.
Open heart, unless it's emergency, unless something goes wrong.
Right,
I got you.
okay.
Emergency bypass. We do not rush people to bypass
Right.
from the cath lab to bypass. We
Okay.
never do
I
that.
Totally
Almost
misunderstood
never,
that then.
unless it's emergency.
Yeah,
Unless
that's
something
it.
goes wrong,
Right.
you crash,
do it.
then we rush you to because bypass, we have to get your blood type, but because you may need blood transfusions,
Right.
right? You have to type and cross, get samples, see what's your blood type, and get your blood units to you. We have to make sure that the operating room it's done in a different procedure, and we have to consent you for bypass. We cannot just do open heart surgery without you signing for it. So it involves a lot of things, unless it's a matter of life or death. It's a different story. Then we
Right.
rush you without consent.
Right.
So, yeah, stenting, we do it right away. Stenting, no, because we consent you for both cath, possible angioplasty, and stenting. Because that could have done a stent, but that will not take care of, the valve, and that's my issue. The valve. Now, the valve, I was talking to you in the room, and then she was doing the echo, and as we talked, then we noticed that she's still working on it, and the valve looked bad, and then we changed based on that valve. I told you that's the last thing we talked about, that
Right.
the valve is involved, and I said
That's
that could
causing
Oh, when she
that
was
could
doing the
change.
echo?
Yes, and that could change the situation where we push things more for surgery if we see a bad valve.
Okay.
So.
Tell me the time frame, Doc. How long will I be here for this procedure?
Possibly
How long will it take?
sometime this week. You'll do it in a couple of days, I would say.
Okay.
Now, you did not get aspirin today.
No.
Can we give him 4 chewable 81 milligram aspirins?
Yes, sir.
Yeah, that would be 325, 24. Yeah.
So
I
this,
put
my chart
the
says
order in,
10,
the
the board
computer.
says 8. Where
They
was
hooked the heparin back up.
where do you want her?
Sure, I think restarting heparin, tell them 1 hour after the TR band is off, if you don't mind.
Yes,
Those
sir.
two things, heparin and aspirin. Consulted Dr. Chadley, so he knows about you, and he will come, him and his associates, to talk to
And
you.
I called Bedward to see if we can get him into CCU.
That would be great.
We're trying. We just
Yes, it's just
been
hospitals.
crazy busy today.
Yeah,
And how do you spell the cardiologist's name?
he's a heart
CH?
surgeon.
Heart
Heart
surgeon.
surgeon.
Yeah.
CHAU.
AUGLE.
CHAUGLE. Okay. Got it. So it's worse than we first anticipated, but fixable.
Yeah, that LED is kind of very tight, and he has some branches that have moderate blockages as well. And you have the valve and you have the carotid, multiple things going on.
That seems all of it hit all at one time.
Well, the fact that your Widowmaker was 90%, you said. I mean, that one would have.
95%, yeah.
That's the one that.
Yes,
That's what
The
caused the
reason why
pain,
it's
I
called-
guess.
yes.
Yeah, that one would
That's
have
it.
been.
Is it unusual for it to
Total.
be, say, 90-95% blockage and him not have previous symptoms?
Yes, we've seen, I have patients with 100% have bridging vessels, or have people 95% in all the blood vessels, and they're walking fine. They drop dead. That's, so sudden cardiac death is
That's called the
20
Widowmaker.
Yes, so 20% of people present to us with death, unfortunately, of coronary disease, because they were fine
So
before.
what they
So-
say is if you feel something, get
Yeah.
to the
Right, but
ER.
it's not super uncommon for patients to not feel anything. There's a good percentage of them that walk around not knowing anything's wrong until it's too late.
Or they think their fatigue and tiredness and shortness of breath is just normal for their age.
Right.
I see that a
was my-
lot.
That was my logic.
So shortness of breath is pretty common, not necessarily sudden, severe, crushing chest pain. That's not common much. You see that, that's when you know for sure. But sometimes you have fatigue, tiredness, dizziness,
Yeah.
shortness of breath. Especially women, they tend to come late because they have arm pain, jaw pain, neck pain. They think it's not a big deal. But also, not every shoulder pain you're going to end up coming to the emergency room.
So the heart surgeon will discuss more on the
On the-
carotid after the
After the carotid
ultrasound,
ultrasound, yes.
to see if
Yes.
when or what would be the best option.
Now, if they go in and do, say, a stent in the carotid, is that gonna affect his swallowing more, like all over again?
They're not going to do a stent in it because he doesn't have symptoms. He didn't have a stroke.
Yeah, the Medicare and the criteria is you cannot put a stent for the carotid. This is unless you document there's a TIA and then stroke or stroke.
Which is what happened to Dwayne.
So that's an issue with stenting, unfortunately, unless he's part of the research trial. For surgery, because they've been doing it for like decades, the guidelines, the American Heart Guidelines and Medicare, they're very loose. They can do surgery. So something to be determined. And also, there is an increased risk to do surgery if it's all radiation induced. That makes it harder to do the surgery. So we'll see what the carotid ultrasound shows. If it's pushing it to the 60%, we leave it alone. If it pushes more to the 80%, we have to. Meaning he probably cannot fix it.
When is that supposed to be done?
Hopefully today.
Okay.
It is what it is, gentlemen. So, don't panic, I'll be all right.
Yeah, I mean,
You're a tough old bird.
the fact that the valve hardening.
But I've had the murmur all my life, and now, my age is starting to affect what's going on.
Sure, yeah, I mean, it's an aging, the valve is definitely an aging.
Right.
Some genes, genetic reasons, because some people age, but they don't have that valve. They have other problems.
Right.
So there is some genetic reasons.
Well, yeah, I mean, oldest of 4 boys, and one has already passed, and, he's always just been, we thought, the picture of health.
Let me ask you about the valve. Will they replace the valve with a mechanical valve or a tissue valve, pig valve?
Most likely pig valves. So if you're 20, 30 years younger, we'd choose a mechanical.
Right.
Mechanical valves would require a blood thinner for the rest of your life. That's
Peters.
warfarin. That's the one you don't want. Warfarin, right?
Warfarin. No, Coumadin.
Coumadin warfarin, that's the same.
Yes, thank you.
That would be the mechanical valve. For the tissue valve, pig valve, or cow valve,
Right.
that would be possibly Coumadin for a few months, 3 months, that's it. If not, depends on the surgeon. So, but you need to be on aspirin and Plavix
Okay.
after surgery. So the tissue valve, they may go down after 10 years or 15 years. Then you go in there and put
10 years all I want.
Yeah,
That's all I want, 10 more years.
20, 30 is good.
Make it worse.
Told him he's got to be old enough to where he's pooping in his diaper and have to change it, and he can be alert and know it. Payback.
I don't want to be around that long. But it is what it is, but thank you for your work.
Thank you, sir. Hang in. All right, thank you all.
We'll
Appreciate
make
it,
it.
Doc.
Thank you.
Anybody have any other questions?
No, I mean,
Okay. Okay, thank you so much.
Thank you.
it was either